Welcome back. Here's something to be ecstatic about. A California biopharmaceutical company says it is seeing very positive results using the currently illegal drug MDMA as a treatment for post-traumatic stress disorder. We've talked about it on this show. I've talked about it multiple times on my podcast. I will scream it from the mountaintops. People should have access to this treatment. It can treat things, everything from eating disorders and anxiety to PTSD. They're hoping the FDA agrees. Is it time to get what is considered a party drug off the street and into your local pharmacy? Joining me now, the founder and executive director of the Multidisciplinary Association for Psychedelic Studies, also known as MAPS, Rick Doblin is back. Welcome back, Rick.
Hello, Kennedy. Thanks for having me today.
So I had a conversation with a woman this weekend over dinner, and she told me a heartbreaking story. She lost her brother, and she was almost suicidal, and she had nowhere to turn, and she felt like her life was no longer worth living, and she felt no joy. She went to an MDMA-guided therapy session, and she said that it changed her brain. She is no longer depressed. She is no longer suicidal, and she wants more people to have access to this. You have been working tirelessly for decades, and now your research is in phase 3 of the FDA clinical trials. You just had your second study completed. What is the significance of that?
Well, there are hundreds of for-profit psychedelic companies, and because we started 36 and a half years ago, we're the only ones in phase 3, and we're actually the only ones that have finished phase 3. So the significance of this second confirmatory phase 3 study is that it's quite likely that FDA will indeed approve MDMA-assisted therapy for PTSD. We think sometime around April, May 2024. And it also means that the whole field of psychedelic-assisted therapy, the work with psilocybin, with ibogaine, with 5-MeO-DMT, with other substances, mescaline, that those are also very likely to succeed. But it's only when it's combined with therapy. I want to make that really important point, is it's not the drug itself. It's the therapy that is the primary active treatment, and the MDMA, the medicine, makes the therapy more effective. So as the story that you heard from this woman that you had for dinner, it's absolutely incredible, and it does produce what's called neuroplasticity, meaning that your brain is now more fluid and you can make new neural connections. So you actually are changing your brain.
And, you know, what I have read based on your work and some of the case studies is, you know, people have been shuffled around from, you know, different therapeutics and different types of therapy, electroshock therapy, opioids, like you name it, for years and years and years. I talked to Marcus Capone, who runs an organization called VETS, and they raise money for veterans with PTSD to go to Mexico to have these kinds of therapy. But the results are so profound. It is so incredibly immoral that our government is standing in the way of this. So people who are at their wits' end, who are lucky to be alive based on the suffering that they go through every day, that they are deprived of this treatment.
Well, I completely agree. And what a lot of people don't realize is that MDMA was a therapy drug from the middle 70s to the early 80s before it escaped and became ecstasy as a party drug. So what we're trying to do is to bring it back to being a therapy drug. There are over 1 million veterans that are receiving disability payments from the VA for PTSD. And it costs the VA in the neighborhood of $17 billion a year just for disability payments. And we've actually had someone from Vietnam War who had PTSD from that in our studies recently and was able to get better. So you can be stuck for half a century almost, and it is possible still to get better. And it would be an enormous cost saving for the government and enormous reducing of suffering. And it's been forever, since 1995 is when we first tried to offer to pay for studies inside the VA. And it wasn't until October 12th, 2021 that the first veteran received MDMA inside the VA for PTSD. And it was a successful treatment. And we're hoping the VA will adopt this.
Google Rick Doblin, Google Maps, see what they do, and, you know, call your congressman or woman, do whatever it takes to get more attention, more focus, more funding. Let's move this into the end zone. Rick, thank you so much for your time. Appreciate it.
Yeah, and I'd like to invite people to the world's largest conference on psychedelics that we're going to have June 19th to the 23rd in Denver in 2023. So we're going to have all the psychedelic researchers from around the world. If people want to learn more, they can come to that conference.
Absolutely. Hey, maybe we'll go there and do a story on it. I'd love to see it. Rick, thank you so much for your time. I appreciate it.
Yeah, that would be great, Kennedy. That'd be terrific. Thank you.
Awesome. I appreciate what you do. And the topical storm is next.